And I'm really excited to have you ladies here today and to be able to share this information with you. This information that you're going to be seeing in front of you is really from Dr. Aviva Ram. She is an MD, but she also was a midwife prior to that, and she's a nationally known herbalist. So I did a certification course with her about 3 years ago, and it really changed how I practice as a certified nurse midwife. So, as a certified nurse midwife, I do um, GYN care, so taking care of all the gynecological problems that women may come into the office for, but then also helping women get pregnant, taking care of them during their pregnancies and postpartum, managing your annual exam and helping you with pap smears and mammograms, and also just finding that overall health balance and making sure that we keep you healthy. And so, as certified nurse midwives, we can do a lot. But I did find about 4, 5 years ago that I just was getting frustrated by how our medical system really doesn't address the root cause problems for what women are going through. And I felt like I was always putting a band aid on women's problems and not really helping them to solve the problem, but just making those symptoms maybe a little less of an issue for them. And that just means those problems keep coming back, or the things that we do, the treatments or the medications, end up giving women even more side effects and more problems. And then we have women walking around who are taking 4 or 5 medications, which in and of itself causes even more problems because those medications don't go well together, or they just are not really addressing your health, and oftentimes make your health even worse. So once I saw that that was happening, and I had been doing it for long enough, and I saw that there was a different way of doing things, I ended up doing an educational program with Dr. Aviva Ram, and learned from her how to marry functional medicine. So that's kind of outside the box thinking when I think about women's health, and bringing the functional medicine and women's health care together and really giving my patients a new avenue to address their problems. So that's what all of this stems from, and that is how I practice now when I am taking care of women, and I totally enjoy it and find that it has just changed my practice and changed my whole outlook. So I'm really, really excited to be doing it and offering that kind of care. So I'm excited to share this with you, and let's get rocking and rolling. And Janine, it's good to see you. Jenny, really good to have you here. All right. So, as I said, or I was going to, I guess, my name is Bethany Monty, and I am a certified nurse midwife, and I own the practice, My Midwife for Life. Um, Also, being a certified midwife, I am a mom of two, a 14-year-old boy and an 8-year-old girl, and it's busy. And I'm also a big proponent for women-centered care, or patient-centered care, whole person care. And as I said, I really do love helping women get to their full health potential. Um, so I think for every woman, no matter what kind of lifestyle you have, or if you have a family, or if you're single, or if you're, no kids, lots of kids, I think we all have that dilemma of trying to find the balance in life, not doing too little, not doing too much, but just right, not feeling like we're just completely run down all the time. And so I would say that that is a challenge that most of us struggle with. And I think that it is possible to find it if you know how and if you have the right support. So oftentimes I find that we women worry a lot about our kids or our job, our career, and that we don't always give time for ourselves to think about our health. So I'm hoping that this session allows you to think about your own health and give you time, and then also guidance to create space for a healthier you. And just know that it all begins with you, and you are important. And I'm excited to help you put yourself in the driver's seat and really make a difference for yourself. So I would say oftentimes for a lot of us, we are all feeling kind of tired. And so I think really our internal clock is our rhythm, and our clocks are usually out of sync. So it's kind of like an orchestra that's lost its conductor. And as a default, each member has decided to come up with her own rhythm, tune, or timing. And so that tends to be how our life works out. I'm going to get rid of my picture here. Hi, ladies. Sorry, I didn't realize that my voice. Can you guys hear me now? I didn't realize it would take me out. You know. So I'm gonna go over it again. Let's all try to close and okay. Sorry. Okay. All right. Sorry about that, ladies. Okay. So, um, as I was trying to say, sorry about that. Yeah, I'm learning this new fangled gadget, this StreamYard, to be able to see you guys and see the screen. So, anyway, most of us are feeling kind of tired, and that internal clock is just off rhythm. So, it's kind of like having an orchestra that has lost its conductor. And as a default, each member has decided to come up with his or her own rhythm, tune, or timing. And so when that happens, we end up with hormone problems, mood swings, fatigue, metabolic problems, and much more. In fact, obesity, digestive problems like IBS, Crohn's disease, irritable bowel is the IBS, diabetes, and breast cancer have been seen to disturbances in our circadian rhythm in a big research study that was done with nurses about, I think it's about 15 years ago. And so when we get our natural cycle off balance, then it leads to imbalances in our hormones and specifically in our cortisol level. And cortisol is the hormone basically that is directing your energy. And let's see here. There we go. Okay. So, cortisol is the master messenger harmonizing what's going on in your brain with what's going on with your body. So it's really bringing those two together. So today we're going to discuss the importance of your adrenal health, or that cortisol, and be dedicating this time to getting to the heart of how those imbalances in your hormones get started, and then also reversing the havoc that can be caused in your body when these things are out of balance. So, if you can think of it this way, when your stress response gets activated, your body diverts energy away from the most optimistic activities in life, such as having sex or reproduction. And so, this actually comes from a research study that was looking into like zebras, and when they're startled or when they're running away from a predator, basically all their hormones shift to where they are not thinking about uh, reproduction or any of those things, and their hormones actually are shifting, and that hormone is related to your ovary. So when you're under pressure, we do have a connection between your stress and the hormones. So we're going to look at that. So your body is actually trying to do you a favor of protecting you from getting pregnant when times are hard or when resources are scarce. So think in times of famine, women don't get pregnant as easily. So when the zebra is running away from or hiding from the tiger that's hunting her, she's not going to be ovulating and then going to get pregnant, and then she has to protect a baby. So it does shift your hormones when you're in that flight or fight feeling of stress. So when you're stressed all the time, your body is going to suppress those female hormones that make for a normal cycle and make for fertility, make for just ovulating. And when you're not ovulating, then it's kind of like a domino effect, and everything else can start to have some problems or shift so that you're not dealing with menstruation and pregnancy. So if we understand that to be true, then you begin to see the connection between stress and menstrual problems, stress and sleep, stress and PCOS. PCOS is polycystic ovarian syndrome. Quite a few women are dealing with that right now. Stress and endometriosis or pelvic pain, painful periods, stress and your food choices, and then stress and thyroid imbalances. And I didn't add on there stress and menopausal symptoms. So it's really important that we understand this connection so that we can start unraveling and changing the direction that we're going. So in particular, one of the ways that we see that stress really changes your body is that the chronic overactivation of your stress response in your body causes a domino effect of immune dysregulation. So it's all just out of whack and going crazy. And that dysregulation and then also inflammation, which can aggravate or may even be one of the contributing causes of common female problems such as PCOS, endometriosis, thyroid disease, and moderate to severe menopausal symptoms. So when I'm working with women, I really am starting to look at that stress reaction, but then also, sure is right for me. I need to focus up. Yeah. And I would say keep on listening, even if you're not sure if this connects for you, because there's more information. So really, I want you to think about assessing yourself for your stress level. So self-assessment, looking to see if by chance your level of stress is affecting your hormones. So do you have difficulty falling asleep? Do you have interrupted sleep? Are you waking up too early? Are you feeling tired and wired? Feeling tired or anxious in the morning, even after a full night's sleep? Chronic overwhelm, fatigue, burnout, anxiety or depression, energy slump at 3 to 4 p.m., needing coffee to start your day, needing it to continue your day, craving chocolate, sweets, salty foods, low or to no sex drive, regularly having blood sugar crashes, which I think a lot of us experience, brain fog, extra weight around the middle, and eating foods that you know that you're just not shouldn't be eating. Sorry, I can't see my slide. And then also using substances such as cigarettes or alcohol or shopping to relax and help yourself, to just let loose. And I know during times of COVID, when we've all been stuck at home, this has been something that I think most of us have experienced in just needing something to relax while we're a little bit stressed out about this whole experience. So healing that stress hormone pathway, what does that look like? So I'm not saying that dealing with your stress is going to be magical or that it's going to fix your life is just going to be completely fixed by dealing with your stress. But what I am saying is that we have to take an extreme and a provocative stand in favor of our health and getting down and out of this chronic stress mindset and into one that is intentionally looking for an inner calm and a more rhythmic, natural pace of life, regardless of your life circumstances. So, even if you are a single mom and you're taking care of the whole household and you have two kids and craziness going on around you, that really taking a firm stand and saying to yourself, I need time for me. I have to de stress. I have to figure this out. I have to put my health first. Otherwise, everything else falls apart. It's important. It's time. And you have to do it. You have to take a really strong stand for yourself. And so, couple different ways that you can do that. Pay attention to how you're feeling. So, journaling and writing down what you are struggling with or what your stressors are. Sometimes just even writing them down allows you to recognize them as being a stressor. Manage your energy. So try not to let your energy leak out by doing 20 million things, but focusing on just a few and giving them all of your energy. So try not to have a leaky energy bucket, but one that you've patched all the leaks and it's going to hold in all that energy. And then you get to dish out your energy according to what you find is most important for you. So instead of or it should be, it's not a hell yes, it's a no. So just having boundaries and figuring out what your priorities are, and then having good boundaries or delegating thereafter. So make relaxed a way of life. So looking into meditation or prayer, stress reduction activities, relaxing yoga before bed, things like that. And then we have lots more information about that. Making your sleep a priority. So, what that looks like is, getting to bed at a regular time, figuring out, hey, if I'm waking up multiple times at night, why? And really digging in deep for that and seeing, okay, how can I maximize my sleep? Is there a little lavender that I can use? Or can I do some meditation before I lay down? Or, hey, why am I waking up? Is there any issues physically why I'm waking up? Did I have coffee late at night? Did I eat a lot of sugar before I went to bed? Or even oftentimes, I am talking with women about, are you snoring? Are you waking up? Um, are you waking yourself up by snoring? Do you have headaches all day long? That can be a sign of sleep apnea. And really addressing that apnea then helps you to sleep better, then really helps with all your stress hormones and finding that balance. So, sleep, number one, a top priority. Um, Keeping your battery charged. So, keeping that blood sugar balanced and not having the peaks and troughs, but finding a balance. And so that looks like doing more of a balanced diet, making sure that you don't have a high carb diet, but one that's balanced with good proteins, good carbs, staying away from the junk foods and the quick sugars. And then also, what can be helpful is knowing your cycle, knowing your menstrual cycle, or just knowing your increase in maybe the way you're feeling. If you're feeling a hormone shift, even if you're perimenopausal or menopausal, you will still have some of that shifting going on. So, getting to know yourself and getting to know those shifts. But if you're still cycling and having your periods, getting to understand that cycle and getting comfortable with it. And then also using adaptogens, which can be certain supplements or minerals and vitamins, and then also nutrients to reset your stress response. So that may look like a magnesium to relax you at night. A lot of us are very deficient in magnesium, a probiotic to help balance intestinal health. And there's a lot more to go into that. Zinc, vitamin C, a good adaptogen that helps with decreasing stress and then also helps your body to handle the stress better. Ashwagandha, reishi mushrooms, maca, rhodiola, and then even dark chocolate, which I think is probably one of all of our favorites. So these are things that you can do to help yourself with relieving stress. So you can think of it as doing like a reset. And I do this with my clients and offer these options to talk about how do we do this reset if you are a patient of mine. And so we would start by addressing sleep, the blood sugar balance, and helping to get out of that overwhelm. So we're looking at a bedtime wind down, sleep as your main priority, like we talked about, the right foods at the right time, high priority living, non negotiable self care, what you will always do no matter what, a quick calm, using adaptogens as an option to help yourself, the after work or evening reset, how to just kind of get yourself back to being at home and in a calm environment. Remembering not a heck yeah, but it's a no. And then be you. You don't have to be perfect. And then also the art of a staycation, just taking time away from responsibilities, but you don't have to leave your house. So, these are options that can help you with stress and overwhelm and those hormonal imbalances. If you really would like some more information that goes much more into depth, then I would highly encourage that you take a look at this book called Hormone Intelligence by Dr. Aviva Ram. And as you guys probably remember, I told you that you would all be entered into a raffle to be able to receive the book. Hopefully, you can see it. It is a great book, and I will be figuring out who wins the raffle after, and then I'll send you guys an independent message. But it's a fantastic book, and I think that it will truly help you to understand your body. So this is for women who are cycling, women who are trying to get pregnant, women who have painful periods or endometriosis, women who are struggling with thyroid disorders, and then also perimenopausal women and menopausal women who are struggling with those symptoms. So it really can, she talks about all those different things and how it's all connected. So I find it extremely helpful. And then also, if you would like to be able to talk with a provider about these things, then I would love to see you. So I offer consultations that are via telemedicine if you're not in Indiana or not nearby me. But then I also have a clinic and I am able to see you in person or again via telemedicine and help you go through this journey of figuring out where your balance is or maybe why you're off balance and giving you the education and the tools to help yourself. So if you see below, this is the website, the mymidwifeforlife.com, and then you can follow me on Instagram or Facebook. If you click on either one of those, it links you there. And this also is a link to my website. So take a look at that as well. So I would love to see what questions you guys have. And feel free to just shoot them at me. And yeah. I wish that I could figure out how to get you guys on speaker, but I'm not sure I can do that. But I would love any questions. Let's see. um, so I think that I did see quite a few women had mentioned that they're really struggling with thyroid health and not knowing how to find the balance on that. Yeah, questions here in the chat. That would be great. Okay. So I will tell you, as far as thyroid health goes, that's one of the main problems that I really help women with and try and figure out how to address it. So oftentimes I find that women are being prescribed medication and they hesitate to take those medications because they have side effects or it leads to other problems. And that can be the case. Sometimes you need the medication, sometimes you don't. Sometimes that thyroid disorder is what we call subclinical. So it's like barely abnormal, but if you can address it, then you start to feel better. And I think someone had mentioned that they were wrongly diagnosed with a thyroid disorder and put on medication, and then their new doctor is trying to take them off of that medication, and that can happen. What I try and do is not jump to medications, but figuring out the root cause or the reason that the thyroid is not functioning to its optimum. And so that tends to be that there can be deficiencies, inflammation, like we talked about. The stress really can make a huge difference in your thyroid. So we look at lifestyle, we look at diet, we look at also many other things that can be going on that can cause that thyroid dysfunction. I think Melanie had asked about DIM. DIM is a supplement it's made from brassicasea vegetables like broccoli, and it basically is very helpful in trying to create a balance in your body and get the extra estrogen that we get from our environment. So we call it exogenous estrogen, which tends to be very not good for us and causes a lot of problems. The DIM helps to push that extra estrogen out of your cells, helps your liver to metabolize it, get it out, and then to get it out of your body. So, DIM can be very helpful. That is one of the supplements that I tend to use quite a lot. So yeah, I think it's a good one. It can be very helpful. Other factors to this. Can you give us a quick overview? Um, oh, sorry, Judy. I'm trying to do the whole question. Okay. Oh, um, yeah, Judy, the other issues that I really find with thyroid health, or just a lot of these problems that I'm mentioning, is intestinal health and lots of imbalances, lots of either chronic constipation, food sensitivities or allergies, or irritable bowel. So, struggling with diarrhea and you're not absorbing all your nutrients, and therefore, then you get even more deficient in your nutrients, which then spiral down for your thyroid. So um, I find that there's really a huge connection between the intestines and the brain and the intestines in our whole body. So it's called, they like to say gut balance is what you're looking for. Let's see. Um, my question is exactly what can I do to support my medical doctor and prescriptions? Also, is there ever a possibility of getting to where I can self manage my tests and thyroid health without a prescription? Yeah, there is. So, basically, I would tell you to get the book, or what you can do is also you can come and see me as a consultation. Keep your physician or your provider. You come and see me. I go over all your lab work. I go over your diet and life experiences, and we really dig in deep and see what's going on and what may be related to your thyroid health, addressing the root cause, and then helping with any deficiencies that you may have. So, oftentimes, we find that women with thyroid disease are very deficient in iron. So they're very anemic. They're deficient in selenium, zinc, and iodine. Iodine's a big one. And that there also can be quite a bit of inflammation in the body that is making the thyroid not work to its fullest potential. So, addressing that underlying inflammation can then help the thyroid to heal itself. So, you definitely have a choice, and there are other options, Ember, totally. Um, Triggered. She says she's 99% sure that the Hashimoto's was triggered a year ago due to trauma or stress. And that can very much be true when our bodies are just in that flight, that stress time. It really stresses your adrenals, or that hormone that gives you the energy. And basically, your cup gets spilled out with that stress so much that over time, you are just at the very bottom and there's not much left in your cup. And if you don't have a lot of energy or that baseline energy to help your body to sustain itself, then your thyroid starts to struggle. And over time, then you will actually see the side effects of that stress and that struggle. You've just hit rock bottom for such a long time that you've drained yourself. And that's when the thyroid starts to not function. HRT, the hormone replacement, definitively can be helpful. You just need to be cautious and careful on how you do it, for how long, and finding the balance. So we're looking at balancing estrogen and progesterone, but then also looking at your thyroid. For a lot of women, they are missing that thyroid component because our standard lab levels for thyroid in the medical in Western medicine and just traditional medicine is a very high number. And in functional medicine, we look at it from a different perspective and start trying to optimize thyroid health when those numbers are creeping up above 2.5. So for a TSH, a thyroid stimulating hormone, that's the common lab that's drawn. We really try and start addressing that thyroid issue earlier so that you're not waiting until you're in dire straits. You believe the thyroid? And Jenny asked, "Do you think the thyroid can heal itself?" And I really do. It just needs to be supported. And here in the United States, our support is very much lacking. We're overstressed, overworked, not a good balance, and then lots of deficiencies. Our diet, our standard American diet, is very inflammatory, but then also it just does not hold the quality that it did 50 years ago. So your apple today is not the same, does not have the same nutrients as it did 50 years ago. And so we are finding that women are overfed but still deficient here in the United States. And so the goal is with thyroid health and with multiple health issues is to make sure that you are not deficient and that we call it repleted, that you're back into balance. Great, but what do you do? So David says, sounds great, but what do you do to help your partner when she doesn't believe that she isn't okay? I know she's not an emotional negative, not happy like she was before she gave birth. She had a traumatic birth, 2 miscarriages. I'm so sorry. Um, sometimes I would say just getting her into a provider who is going to give her time to talk about those things and to see how she's feeling. Oftentimes in your normal OBGYN office, you get 10 minutes or 15 minutes for your annual exam or your postpartum visit or even a problem visit, and it's just not enough time. So with my practice, I really try and give women all the time that they need to really dig in deep and see how they're feeling and see how we can meet them where they are. And so I would recommend that maybe you let her see this video or, say, hey, I saw somebody really good. You might want to go and see them. And I would love to help her. And it can be via telemedicine where we can just talk. Also, David, what I do is I have women fill in questionnaires ahead of the visit. And so for myself as a patient, I notice that once I write things down, then I start to see the connections and I go, oh, this is happening and this is happening. And this is bigger than I thought. Oh, I really don't feel well here. And it really starts to bring in all the connections. And then you're able to see that whole picture for yourself. In our medical care right now, women, men, children, we're all pieces and parts. So your brain is having a problem, you go to this person. You're having an upset stomach and having diarrhea, well, then you see the gastroenterologist. Or you're having a thyroid problem, you see the endocrinologist. And nobody is putting it all together. And so with functional medicine, or what I like to call whole person medicine, is actually looking at that whole person, putting the pieces and parts together. I'm not going to say I'm an expert in every disease process, but putting the pieces together. And then if I feel like you need to be seen by a psychiatrist or by a therapist for counseling or by an endocrinologist because things are a little bit further than I can handle, then I make those referrals, but I'm still with you to help you go through the process and understand maybe what that specialist has told you. And so that's what I really like to do. Also, David, I would tell her that there is hope after those 2 miscarriages and that it is not hopeless, but most of us feel that way. So it is definitively not hopeless. Marcy says, if doctors can't figure out for sure if it is the hormones, what do you start with? I have lots of stress in my life, but I use breathing and meditation for anxiety. So now what? Sorry, I'm at a point of having surgery because of weight gain. Okay. So, I would say that usually in your standard medical office, they're really, like I said, not putting all the pieces and parts together and looking at you as a whole. And so that is what I would encourage you to do, Marcy, is to be able to see someone that's going to help you put the pieces and parts together and help you maybe with that weight loss, and help you with that anxiety and stress. So there can be components that your doctor just isn't able to address because there's just not enough time. But that's what whole person medicine practices are all about. Let's see here. With DIM, what's the recommended dosages? You know, Debbie, I don't have that on me. Sorry, I don't have it memorized, but I will see if I can send that to you on a message, okay? She doesn't acknowledge that all the things are in balance. Yeah. Okay, so and Debbie says she has anemia, and I think it's Hashimoto's is what she's saying. So Debbie, you can address that anemia, and then addressing the anemia better will help the thyroid to heal itself. So, but you also need to figure out why you're anemic. And so that could be that you're losing blood through your intestines and you don't know it. It can be just that you're really deficient because you're not absorbing all your nutrients. It can also be just that the iron supplement that you're on is not working and you need to try something different. Amy says, this may be a silly question, but with chronic stress and stifling reproduction, can chronic stress lead to menopause earlier than what would normally happen? So it can, Amy, but then also what you might be experiencing is that it's just the stress is shutting down your proper ovulation. So if you're not ovulating on a regular basis and it's not to its fullest potential, you will start to have hot flashes and night sweats and not feel like yourself. So there are some very easy ways to handle that, especially looking at your stress levels. But then there are some really wonderful, beautiful herbs and supplements that I've been using over the last 3 years that have made just a huge difference in my own health, but then also the health of my patients. Very easy, not expensive. But then, you know, just also addressing your whole health will help with those things. So you do not have to be stuck with those symptoms. I've been through menopause already, says Bev. Where do I find the recommended level of hormones for someone my age? So Bev, I practice in the way that I only look at hormone levels if a woman is having symptoms. So if you're having menopausal symptoms and we're going to try and treat them either with hormones or maybe with some supplements, then looking at your hormone levels can be helpful. But if you're not symptomatic, then there's no need to look at those hormone levels because we already know that they are declining because that is nature's way. That's how it works. But you will find that when you are talking with, say, a regular OBGYN, they might not want to check them very often, and that's quite common because it's hard to know exactly what to do with them. Oh, sorry, here's your question. So you can do some functional medicine testing. Dutch test is helpful, helps to really dig in deep and look at your estrogen and progesterone levels and testosterone as well. So that can be an option. And that's something that I do. Oh yeah, the name of the book, Ember, is The Hormone Intelligence. Let me make sure you can see it, by Dr. Aviva Ram. And you can get it on, oh, I thought I put her book on here. Sorry, it's not on the slide. I will give you the link, I think, on Amazon. Not real expensive. Yep. Overfed and undernourished, Jenny says, for sure. And that's what we really need to start looking at here in the States. Yeah. And then Debbie says their oil is depleted. Let's see. Lori asked, probiotics, what's the best form? So dietary probiotics are the best form. So you mentioned kombucha, but also doing high fermented foods. So fermented pickles or kimchi, if you're If you like Korean food, which I do, sauerkraut, those can be good, but then also a very good intestinal probiotic. Keeping in mind that probiotics need to be cycled about every 3 to 4 months to get that full benefit. But yeah, probiotics can be really helpful in decreasing um, bloating, abdominal bloating, or constipation and diarrhea. However, if you've tried a probiotic or you've tried increasing your dietary intake and you're not seeing a difference, there may be some other problems underlying that you would want to take a look at. David said, do you think you should get her thyroid test because of the stress of the birth? David, the thyroid can be playing a component in her mood and her energy post-birth. So for some women, it can be a nice, wonderful birth, but just that flip and that change in her chemistry in her body from the birth can be attacks on the thyroid. And then also the stress of taking care of a newborn and not sleeping. But then when you add on a traumatic birth or traumatic losses, we do find that women can run into thyroid disease when they didn't have it prior. So it's kind of a trigger. So I would definitely say getting her thyroid checked, doing a full panel. And so she would want to talk to her provider about that. Or again, David, if you felt like I could help in any way, that's what we would do. And then Ember says, where do you recommend sourcing your vitamins to combat deficiencies? So I can say for myself, I felt like okay, let's go to a Whole Foods or let's go somewhere else and look and see what I can find. I'm very overwhelmed going in those aisles, and I even know what some of them are. Um, so I have taken to not shopping at Whole Foods or Amazon because I'm not sure exactly what they say is in the supplement is actually in it. And so I use a dispensary called Full Scripts or Wellevate. And with my patients, I link them to a recommendation on that page. It's an online dispensary. I know there are quality checks and that they are really making sure that what the company says is in the bottle is actually in the bottle. And so they also are properly shipping, and so that the supplements are not destroyed en route, which is important as well. In the UK, she says, sorry, in the UK, we don't really get to see a gynecologist unless there's something very wrong, like cancer. Here, okay, the NHS is free, but it doesn't really act in a proactive way. And I've heard that before. And I know that a lot of people come to the United States and try and get that care. So Debbie, an option is that you can just send me a message and we can talk about just maybe doing a consultation online to talk about ways to ask for those services or to find labs near you. Here in the United States, you can actually go to certain lab companies and order your own labs. And then if you were to get those lab results and then send them to me, I might be able to look at them and help you interpret them if that would be helpful to you. Oh, David, it's so good to hear you say that you have a beautiful son and that he's worth it all. And he is, but your wife is worth it all too. And she really deserves to feel better. And so, all of us women here are cheering you on, and we applaud you for loving your wife and your son so well. And we will help you in any way that we can. Um, let's see. Oh, Debbie, I'm sorry. Hereditary hemorrhagic. Okay. That's one I'm not very familiar with, Debbie, but I can totally look it up and you can always message me. Let's see. Oh, thanks, Ember, for putting the book link on there. I had it on the slides and then I don't know, it has disappeared. Ember, it's really nice to have met you. Yep, you're right. On Audible. All right. Everybody only okay. Let's see here. Marcy says, is my 2 p.m. crash every day only related to my sleep problems, or is it my body missing something? So Marcy, it can truly be both. And if you're having sleep problems, that would be my first thing that I would focus on. Deficiencies, totally. So they're very much married. So I would want to talk to you about When are you going to sleep? How long does it take you to fall asleep? Are you snoring when you sleep? Are you waking up to go pee multiple times? And then we could also look for deficiencies. So, looking at your iron and making sure you're not anemic, because restless legs and sleep disorders are related to anemia. Um, a fact that I did not know until I started doing this 3 years ago. And I never got that in my medical education. And then also we can address most likely a magnesium deficiency, because lots of us are magnesium deficient. I don't test for it. I just treat. I give you a really good magnesium that is good for rest and relaxation. And also, if you have any issues with constipation, we can use kind of a combination one that is really tremendous. Lori, I'm really glad that you like the information. I'm really glad that you showed up. And Debbie, really glad that you showed up as well. Does anyone else have any questions before we go? Because it is one. I think also I'll just give you my phone number. I didn't put it on here, but it is 317-659-6484. And feel free to give me a call and let me know if you have any other questions or if you would like to be seen. If you go to my website, there is a link there that then shows you all the services and prices and availability, and you're able to schedule your own appointments right on there. Or you can leave me a message on there with your email and phone number, and I'll get right back to you. So they're all available. And Debbie says, I knew about the restless legs link, but also if a patient is craving ice. Yep. So that's very, very common. Debbie, I'm not sure, but I hope that they have you on a really good chelated iron supplement. That's what you're looking for, is the term of chelated iron. And Ember says, thanks for the information. Ember, really a pleasure to have you. And Marina, thank you so much for coming, and thank you for all the encouragement. And I hope that we can all remember just to put ourselves first, and to just put the oxygen mask on yourself before you're trying to put it on everyone else, because that's the only way that we survive, and it's the only way that they have a good mom, sister, wife to rely on and find and pull strength from. Tess, thanks so much for coming. Really a pleasure to see you here. Anyone else have any other questions before we head out? And if not, I will let you guys know who won the book, and I will send it to you. And then I'd love for you to follow me on Facebook or Instagram. If you click on either one of these, the icons, the Instagram or the Facebook, it links you to those pages. So that makes it pretty easy. And I would love to help you in any way that I can. So just reach out. Okay. All right. Thanks so much for showing up today. Hope you have a nice day. Yeah. Debbie, take care. Okay. All right. Hopefully see you guys soon. I'll try another Facebook Live sometime soon to give out some more information. All right. Take care. Bye-bye.